Welcome to On Health with Houston Methodist. I'm Zach Moore. I'm a photographer and editor here, and I'm also a longtime podcaster.
I'm Kim Rivera, Huston-Weber, and I'm a copywriter here at Houston Methodist.
And Kim, when was the last time you went to the cardiologist?
You know, I actually don't have a cardiologist at this time, but heart issues do run in my family, so that's always a risk I might have, that I might one day need one.
I also do not have a cardiologist at this present time, and not something that had occurred to me to look into, at least right now where I am. Fortunately, health-wise, I don't have a history of heart conditions in my family. I haven't experienced any myself, and that's our human nature, right? You're not going to address it until a problem comes up, and that's kind of where I am right now as far as cardiologists go.
Yeah, and what I think is very interesting is that cardiologists can help manage maybe some of the things that are risk factors for heart disease. So they're going to help manage cholesterol, they can help manage blood pressure. And those are things that you can work with a primary care doctor with as well. But I think maybe having that specialized care might help prevent heart disease from ever occurring.
Yeah, we like to talk about preventative care here at Houston Methodist, and a cardiologist is, I feel, is on page one of that list, right?
Yeah, I think it was very interesting to hear our expert today talk about how, I guess my perception always was, if you need to see a cardiologist, you already have something perhaps serious happening with your heart health. But what I learned is that really a lot of cardiologists' work is to prevent you from ever developing heart disease. And so it was really illuminating. I was surprised how much I didn't know.
Yeah, and who did we talk to today about this, Kim?
We spoke with Dr. Joe Aoun. He's an interventional cardiologist here at Houston Methodist. I think it's safe to say that navigating healthcare can be challenging at times, knowing who to see and when. So on the podcast, we've been exploring specialty care topics to help folks get a better sense of what they can expect when they're working with a physician on their care. And today, we'll be talking about all things cardiology. So to start, what is a cardiologist and what do they do?
So a cardiologist is a medical doctor who actually specializes in diagnosing and treating heart disease and vessel or blood vessels disease. So basically, that's what we call cardiovascular disease. Now, a cardiologist has to be an internal medicine specialist who specializes further into cardiovascular disease. And sometimes we see subspecialists, including interventional cardiology, such as myself, electrophysiology, and others, which we'll probably talk about today.
What are some of the common and not so common conditions that cardiologists treat?
So in general, some of the most common conditions that cardiologists treat include high blood pressure, for example, which is hypertension. Other diseases can include coronary artery disease, which are clogged arteries that give blood supply to the heart. And other diseases can include heart failure, when the heart is very weak, and then irregular heartbeats or rhythm problems, such as atrial fibrillation, for example. Less commonly, we treat with patients who have congenital heart diseases, where they have defects when they're born, for example, or they have certain cardiomyopathies and valvular heart diseases. For example, I'm a specialist in valves, and I treat conditions and I do transcatheter interventions on valves, such as mitral valve and aortic valves. Those are not uncommon, but sometimes we have to treat them with interventions or medications based on that.
What cardiology subspecialists support these various conditions?
So we have a total of big four, if you want. One is in interventional cardiology, which are the plumbers of the heart in a way, so they can open up clogged arteries. Sometimes we treat valves, as I mentioned, with transcatheter options without opening the chest. That means going through the groin or the wrist and fixing the valves. Other specialists include electrophysiologists, which are cardiologists who focus on the rhythm and problems in the rhythms of the heart, such as irregular heartbeats or patients who have some dizziness related to their heart issues. And then the third category is heart failure specialists. Whenever the heart is very weak and they really need advanced therapies, such as heart transplants, and what we call LVAD, which are assisted ventricular devices. And then finally, we have cardiac imagers who are subspecialized in looking and reading echocardiograms, which are the ultrasounds of the heart, CT scans, or cardiac MRIs.
Can any of these big four be surgeons, or are they their own specialty?
Cardiologists are usually not surgeons. Interventional cardiologists and electrophysiologists, they do procedures, but they're usually not open heart procedures. Cardiac surgeons are different specialties. In a way, they tend to do procedures such as open heart surgery or sometimes robotic surgery. Those are not done by cardiologists.
Does someone need to work with a primary care doctor or a primary care provider in order to see a cardiologist, or can someone make an appointment with a cardiologist directly?
I think that's a very important question, and the answer, it will depend. It depends on several things. Sometimes the healthcare system, sometimes the insurance. And I would encourage any patient to contact their insurance before they have an appointment with their cardiologist. The main reason is, last thing you want is getting a huge bill to your place just because you did not get referred by your primary care physician. Sometimes it's okay to just go to a cardiologist, and insurance companies and healthcare systems would allow that in certain situations, and that's very important to check. I would encourage any patient to contact their primary care physician and tell them about their symptoms, because sometimes it's not the heart and they need to be referred to other medical specialties.
And I think that's a great segue into what are some of the classic symptoms that would signal someone should see a cardiologist, or maybe take that first step and talk to their primary care doctor?
The most common symptoms that we encounter patients having are chest pain or discomfort in the chest. Sometimes they say, oh, I have an elephant sitting on my chest, for example. Other stuff include shortness of breath. So whenever I'm starting to exercise, I'm having this shortness of breath. I cannot really breathe comfortably. This didn't used to happen before, and this is new. Palpitations, heart fluttering or heart racing, swelling in the legs, which can sometimes be related to heart disease, or sometimes to the kidneys, sometimes to the lungs or the liver, but it's important for us to check the heart. And finally, dizziness, lightheadedness, fainting, all of those can be managed or at least assessed by a cardiologist.
And are there any symptoms that we're having that should prompt us to either call 911 or go to the emergency department? And which ones would be best suited for us to just see our primary care doctor or seek a cardiologist's care?
Yes, so if someone is experiencing chest pain that lasts more than a few minutes, and especially, let's say they have some sweating, some nausea, some difficulty breathing, then definitely call 911. If they're feeling that they have this elephant sitting on their chest, and that chest pain is radiating to either their back, their left shoulder, or their jaw, those are signs that are typical of a heart attack. It's not the pain that goes within a second, it's the pain that lasts a few minutes. Other things that are important and considered that are essential that we need to seek urgent or emergent medical care can include like sudden onset of shortness of breath, or fainting, or irregular heartbeat that are not going away and I'm having shortness of breath with. Some other conditions that are most commonly treated in the office would usually include like mild chest discomfort that went away, for example, or I've had this irregular heartbeat for a few minutes, it hasn't happened again, and or it's intermittent, maybe every week or every other week I have that, or every month. Those are conditions that can be evaluated just in a clinic setting in a way.
Yeah, you're getting your notification on your watch that your irregular heartbeat's happening. Yeah, that makes sense. We've talked a lot about symptoms, but are there risk factors that should make someone consider seeing a cardiologist even if they're not showing any of those symptoms yet?
Absolutely. I think it's important to know that genetics play a role. So number one factor is actually family history. So if I have a history in my family of heart disease or heart failure or heart attacks, especially at a younger age, I think seeking the care of a cardiologist is very important. Other stuff include risk factors such as smoking. I've been smoking for a long time, then it's important. Uncontrolled high blood pressure, diabetes, and then obesity. And finally, with age, I mean, we know that heart disease is commonly occurs in older patients. So with age, some patients, they need to see their cardiologist in order to make sure that there's no heart disease.
After the break, we speak with Dr. Aoun about what you can expect during your first cardiology appointment.
From annual checkups to managing chronic conditions, your healthcare should be personalized to you. At Houston Methodist, our primary care doctors provide customized care for you and your family, with more than 40 convenient locations across Greater Houston. We offer a variety of ways to get care, from in-person and virtual appointments to same-day visits when you're sick. Choose your doctor and schedule online at houstonmethodist.org/stayhealthy. Houston Methodist, leading medicine.
In general, what can you expect at that first appointment? Are we going to be getting any tests, or are there any kind of standard questions that we should be ready and raring to answer?
Definitely. So I think in general, whenever you meet your cardiologist for the first time, you're going to expect a lot of questions. One, we really want to listen from the patient, what symptoms they've been having, how long they have been having these symptoms. So medical history is very, very important. The second thing is family history. So what's been happening in your family? Did they have diseases at a young age? And then the third thing would be, what has your lifestyle been? Have you been exercising? What diet have you been having? Do you smoke? Do you drink alcohol? And we really are interested in some of the details that are important. And we might tend to tell you, hey, please explain the symptoms in your own words and elaborate on that. And that's very important. Now, it's not routine that we do testing on the first appointment, but in case that you need some tests, one of the most common tests that we do is called electrocardiogram. We use a machine that actually checks your heart rhythm, and it gives us a tracing, and it tells us the basics and the baseline of your heart rhythm at that moment when we do this test. Now, other things that we do in clinic are blood pressure checks, and we check the heart rate. Sometimes we order an echocardiogram, which is an ultrasound of the heart, in order to see if the heart function is normal, it's not really enlarged, if there are any congenital abnormalities or not. All those are very important. And lastly, we check some blood tests. For example, high cholesterol. If you have diabetes, we might check your A1C, which is the reserve of the blood glucose in the blood, for example. And in certain situations, we might, if somebody has been having chest pain, for example, we might tend to order a stress test. So a stress test can be on a treadmill done, or it can be using a machine where we inject some medication in the blood vein and then put them in that machine, which is close to a CT scan, but not pretty similar. But those are not done the same day of the visit. Those can be done further down the road.
Are you going to come out of your cardiologist appointment with some homework? Are we going to have to start tracking our blood pressure? Or kind of what are some of the follow-up steps that you might encounter?
Yes, definitely. So I think it will depend on the disease of the patient or the condition or the risk factors. But a lot of the time, our patients have more risk factors than the disease itself. And we would tell them that lifestyle changes are very important. And definitely, no matter what we can do as cardiologists, I think the patients are the leader here, right? So whenever we advise them, we would want them to exercise more, control their salt intake, for example, be on a healthy diet, more vegetables, maybe less meat, stuff like that. But definitely, majority of the time, we recommend these things to our patients. And I think we cannot really improve their health without that decision and that lifestyle change that they will do.
That's so interesting because in preparing for our conversation, I encountered an analogy from another cardiologist. And it was that there's a ship, a captain, and a first mate. And the patient is the captain, and the cardiologist is the first mate who gives information and counsel. But ultimately, it's that patient, the captain, that has to make decisions and sail the ship. So does this analogy resonate with you? And, how would you describe the cardiologist-patient relationship?
I mean, I really love this analogy. It really captures the collaboration between the patient and the physician. And I think as a cardiologist here, my role is to provide the expertise and information and guidance to help the patient understand what the disease is, what can they improve. But at the end of the day, the patient are the captain of their own ship. They are going to make their own decision. They're going to manage their healthcare. We're going to provide them with options on how to treat their condition, and they're going to be sort of choosing what is the best approach for them, right? I mean, sometimes we might recommend something that is medication, and sometimes we might think that actually the procedure is the best option, but the second best option might be actually medication. But then the patient would decide, hey, I do not want to have the procedure right now. Maybe I will just try the medication. And that's okay sometimes. In certain situations, our recommendations are really important, and we tell them, hey, this procedure is life-saving, and that's when we tell the patient that, hey, you should proceed with that. By the end of the day, they decide if they really want to go through this. Again, being a good captain means actively participating in the care, right? That doesn't mean that, hey, if we do this procedure to the patient, that's it. No, lifestyle changes are important. Taking the medications are important. Following up with the primary care and with a cardiologist is really important, and making sure that they track what they do. For example, if let's say somebody has really high blood pressure and then we give them the medication, we want to know if they're taking the medication. It's really important for us to know if they are on low salt diet and they're following that diet. And if they're measuring it at home, is it really well controlled? And we cannot really know that without the patient, right? So they have to be the captain. And once they start taking care of themselves, I think with our guidance, they will do a great job.
And so it sounds like being a good steward or being a good captain is all about that engagement. And is it fair to say that if you're not very engaged, then perhaps, you kind of get what you put in?
Yes. So basically, being a good captain involves being proactive, informed, and engaged. So here are like some few tips. Number one, I would say be honest and detailed. So we want to hear about your symptoms. We want to know when they started, what makes them better, what makes them worse. Just tell us everything. Second thing, ask questions. By asking questions, you're going to know what to do on a day-to-day basis and what to expect in the future. 3 is be open to making changes. Again, lifestyle changes are very important, and we might recommend that. And nobody wants to change what they've been doing for a long time, but if it helps you, then why not? And finally, keep track on your health. So monitor your blood pressure, monitor your diet intake, and give us all this information so we can help you in the future.
You bring up such an interesting point about honesty, because I think anyone who goes to their doctor and, the doctor's asking them questions, doctors are very prestigious and they kind of hold places of power. And so, I'll speak for myself. I don't want to let my doctor down by telling them how many glasses of wine I have in a week. Like, nobody wants to let their doctor down. But it's very important that you are honest with them, because they can't help you if you're not honest.
I agree. It's one thing that physicians tend to, give advice. But trust me, it's not easy for them to follow their own advice. So we all know that we're human beings, right? We recommend that you should do this, you should do that. That doesn't mean that every physician is doing this and that. And by the end of the day, lifestyle changes is difficult. But what we say is what we have learned throughout experience, throughout studies, and all those recommendations are based on evidence-based medicine. And if we don't really know what your lifestyle has been, we cannot really make recommendations to help you specifically. So I would say honesty is number one, no matter how hard it is, because after that, everything becomes easier.
Can you share what people may expect if your cardiologist refers you to a subspecialist, such as an electrophysiologist?
So cardiologists in general, despite that they're very specialized, most of them can treat with basic bread and butter cardiology and heart diseases. Now, the most important is when your cardiologist wants to refer you to a subspecialist for a certain particular condition in the heart. That's when it's really important to find the specialist that you really need. In a way, if you're dealing with a heart rhythm, a general cardiologist can treat majority of those, but let's say if you need that to be ablated, they will have to refer you to a specialist, such as an electrophysiologist. And the field of cardiology has been progressively and over time has been impacted by so many advances. We, at this point in time, are able to do so many interventions that we have never thought of that we can do through transcatheter options and transcatheter-based therapies. And all of those, despite that they have been new, a lot of them have shown that in certain situations they can be as important or sometimes better than open heart procedures. That's why cardiologists in general tend to do these meetings, what we call multidisciplinary meetings between cardiologists and surgeons, cardiovascular surgeons, and other subspecialties in order to determine what is the best for this specific patient. In other words, sometimes surgery is the best option, and cardiologists push for that. Sometimes putting a stent is the best option, or sometimes doing a repair on a valve using an open heart surgery is a better option maybe. And in certain situations, transcatheter-based options by going through the groin or the wrist are the best options. And at the end of the day, despite that we would recommend the best options, again, the patient is the captain of the ship. So they will decide what they want and what we will do for them.
Heart disease runs in my family, so I can imagine feeling some level of trepidation about needing heart care. But from what you've shared, it sounds like with improvements and treatments and procedures, you can work with a cardiologist and you may never see the inside of an operating room. Is that fair to say?
Yes. So what we do in general for patients who do not have heart disease, we actually work on prevention. And the most important thing is actually prevention of having a heart disease more than fixing or managing the heart disease. A lot of our work is actually treating the risk factors for getting heart disease, such as high blood pressure, diabetes, other stuff. So we actually are prevention specialists in a way to try to stop heart disease from happening. But in case it happens, we are able to diagnose and treat those conditions. And hopefully we can get by without even needing an intervention, which is a procedure or a surgery. And again, prevention is very, very important.
When we're thinking about potential treatments and interventions we might have when we're working with a cardiologist, what do those look like?
So first thing is actually lifestyle changes. This is the bread and butter. And majority of the time that comes before the medical therapy. The second thing would be starting a medication. And sometimes that does not cut it, or in certain situations, which are or conditions that are life-threatening or not on the short term, maybe long term, sometimes interventions such as transcatheter-based or surgical-based are recommended. But again, we try to prevent as much as possible, but in case the disease is there and it can be fixed by lifestyle changes or medication or procedures, this is when a cardiologist would intervene.
So this has been so enlightening, and I'd love to know, is there any last message you'd like to leave our listeners with before we wrap up today?
So cardiology has been a growing field. Years ago, back in the 1990s and even before, medical therapy was the only option. And a lot of our patients sometimes did not make it to be elderly. And that's because heart disease is the first cause of high mortality in the United States. At this point in time, with the advances in technology and medication and prevention, Our patients are currently living longer and living healthier. And basically, we want them to make a decision and have set goals that we can work on with the medications or sometimes with procedures to get them there.
Thanks so much for being with us today, Dr. Aoun.
So cardiologist, Kim, not to fear.
No, I don't think so, which helped ease some of my trepidation about potentially needing heart care down the line, or just even thinking about getting that referral from your doctor being a scary thing. And it's not anything to fear.
Mm-hmm. And as usual, our experts, the advice they give us, get your proper 7 to 8 hours of sleep, eat healthy,
control your blood pressure,
right.
Control your A1C or your blood glucose.
Right.
Yeah. I think the American Heart Association has their Essential 8, I think it's called, which are all of the heart healthy habits you can do, quitting smoking, eating healthy. All of the things we really kind of talk about here on the podcast are part of that Healthy 8. So, a lot of preventing seeing a cardiologist comes down to basic healthy habits.
And of course, all that sounds like common sense, but there's a reason we have to keep reminding people, and there's a reason that these issues crop up. And
yeah, and I thought what Dr. Aoun had to say about us all being human and knowing that change is hard, but trying to be a good advocate for yourself to have the kind of outcomes you want and the kind of life you have.
Mm-hmm.
I found that very inspiring because, I think when you're starting on a health journey, it can seem very, very daunting.
Right.
But kind of what your outcome, what you want to have is, like, you want to be able to be healthy as you age. You want to be able to see your grandkids graduate from high school or college or whatever. Taking steps to help you achieve those goals are really what doing all of these things that we don't want to do, like eating healthy, that's what it can do for us.
Well, and I really like what you guys mentioned about you need to be honest with your doctors, right? Because there's that guilt or shame or like, hey, have you been doing this? And you want to say, oh, of course I have. And you haven't, right? And they can't help you unless they have all the proper information, because it's like, well, if you're not doing steps 1, 2, 3, getting to steps 4, 5, 6 don't even matter because your foundation is all messed up. You have to be honest about that, get that solid foundation of health, and then you can move on to the deeper steps, right?
Yeah. And, I think there is a certain amount of, we don't want to let our doctors down
right
when we're in there. And it can also, like you said, the shame can crop up. But if there's no one you can be honest with, you probably should be very honest with your doctor, because otherwise they're working with incomplete information,
right,
and you might not get the care that you need if you're, hiding how many glasses of wine you have in a week, or if you're hiding about, I go to steak night every week, or like whatever it is that you might be doing.
Yeah, I mean, that's the time for brutal honesty on both fronts, right? Because you want to, I mean, at least the way I think about it, you want to hear it straight. Like, here's what your issues are, where you need to be, and if you don't do these things, you're at risk, whatever that risk may be.
Cardiologists really are intervention specialists, and I was so surprised to hear that, because I thought if we're going to have to see a cardiologist, we already have heart disease, right? We already have something serious happening. But I think so much of what they do is helping you from ever developing heart disease. You might not need to have a catheterization, or you might not need to have open heart surgery, because you've been working with them for so long and you're managing your heart health, and it's not an issue.
Right. So don't be intimidated by going to the cardiologist. They are your friend.
Yeah, they are your friend, and they can help you live the best life that you can.
Absolutely. Well, that's going to do it for this episode of On Health with Houston Methodist. Be sure to share, like, and subscribe wherever you get your podcasts. We drop episodes Tuesday mornings. So until next time, stay tuned and stay healthy.